The dog saw her first. That was the thing nobody on the unit talked about afterward, but Nurse Petra Solano thought about it constantly. How the animal, a massive black German shepherd with a white scar running through his left eyebrow, lifted his head from the floor the moment she stepped through the door. How he watched her cross the room without growling. How the veteran in the bed, the one who hadn't let a single staff member within 4 feet of him in 3 days, noticed and went very, very still. His name was James Keller. Former Army Ranger, 2 deployments to Afghanistan, 1 to Iraq. 39 years old. He looked 60. He'd been brought in through the ER 6 days ago after his neighbor, a retired postal worker named Opal, who checked on him every Thursday, found him sitting on his kitchen floor at 2 in the morning, unable to speak, unable to stand, the dog pressed against his side like a warm wall. She hadn't called the VA. She'd called 911, which is how James Keller ended up at Mercy Ridge Medical Center in Charlotte, North Carolina, instead of the Veterans Hospital 20 miles north, and which is how everything that followed happened the way it did. Petra had transferred to Mercy Ridge 8 months earlier from a trauma center in Fayetteville. Before nursing, she'd spent 4 years as a combat medic with the 82nd Airborne, 2 of those years in places she still didn't name at dinner parties. She was 31 years old, 5'4", and had the kind of quiet that other nurses sometimes mistook for coldness until something went wrong on the floor, at which point they understood it for what it actually was. She hadn't been assigned to Keller. That was the first thing her supervisor said when everything came out. Petra had been assigned to beds 4 through 9 on the behavioral health unit. Keller was in bed too. She'd seen his chart on a Tuesday morning when she came on shift, and the overnight nurse, a man named Trey who never looked up from his phone during handoff, summarized the situation in 11 words. Ranger in 2 won't cooperate, has a dog, administration's pissed. That was enough for Petra. She didn't go in right away. She stood in the hallway outside room 2 for a moment, just long enough to look through the narrow window in the door. James Keller was sitting up against the headboard with his knees pulled to his chest, both hands visible, the dog lying across his feet. His eyes were on the door. They were always on the door, Trey had said. The man had not slept more than 40 minutes at a stretch since admission. The dog's name was Ranger. Petra found that out from the intake notes, which also noted that the attending physician, Dr. Stokes, had documented the animal as a potential infection risk and non-standard support item and had twice requested that hospital security remove it from the patient's room. Both times, Keller had, and this was the word Trey used, snorting, barricaded. What that actually meant, Petra discovered when she read the incident reports, was that Keller had pressed himself into the corner of the bed, positioned the dog between himself and the approaching security officers, and said, very quietly, that if anyone touched his dog, he would consider it a threat. He hadn't raised his voice. He hadn't made any physical move toward anyone. He had just said it, and something in the way he said it had made the 2 security officers look at each other and decide to go speak with their supervisor. Dr. Stokes had not found this amusing. Petra had been at Mercy Ridge long enough to know Dr. Stokes, 47, department chief, the kind of man who said evidence-based in a tone that meant mine. He was not a bad physician. He was, however, a physician who had never served, had never sat with someone at 3 in the morning in a place where everything outside the wire was trying to kill you, and had absolutely no framework for what he was looking at when he looked at James Keller. She knocked twice on the door of room 2. Soft knocks. Not the brisk rap of someone who expected to be let in immediately. There was a pause. What? Keller said. Not a question. Medication time, Petra said. Which was true. She'd checked his chart. He was 40 minutes overdue on his blood pressure medication because Trey had documented patient non-compliant will retry it next shift. Pause longer. You can come in, Keller said. Petra opened the door slowly. She did not walk directly toward the bed. She moved to the left, toward the small chair near the window, and sat down. She placed the medication cup and the water on the bedside table without handing it to him directly, just set it there, in reach, and left it. Ranger lifted his head. He looked at her for a long moment. Then he put his head back down. Keller watched all of this. He doesn't usually do that, he said. Do what? Settle down, with someone new. Petra looked at the dog. He's a good judge of character, she said. It wasn't a line she'd planned. It was just true. Keller looked at her for the first time. really looked, not the flat threat assessment scan he'd been giving every person who entered the room. His eyes were dark green and exhausted in a way that had nothing to do with sleep. "You served," he said. It wasn't a question either. 82nd, Petra said. Medic. Got out in 2018. Something shifted in his posture, barely perceptible. The shoulders dropped maybe a quarter of an inch. He reached out and took the medication cup. That was Tuesday. By Thursday, the situation had become what the hospital's patient relations coordinator, a woman named Beverly, called a significant operational challenge. What Beverly meant was that Dr. Stokes had filed a formal request to have Ranger removed from the facility on grounds of hospital policy, specifically a policy that allowed service animals but required documentation from a licensed mental health professional certifying the animal's status and training. Keller didn't have that documentation. Not because Ranger wasn't a legitimate service animal. The dog had been certified through a veteran assistance program in 2021 and had a vest, tags, and a 6-inch thick file somewhere in a VA record system. But because Keller had been admitted in crisis, his records hadn't transferred and the VA liaison hadn't returned anyone's calls. Petra found all of this out because she asked. She asked Keller, who told her about the certification program and the paperwork he'd signed 3 years ago. She asked the VA liaison office and was told someone would look into it. She asked Beverly, who was sympathetic in the practiced way of someone whose sympathy had been honed into a professional tool. "I understand your concern, Petra," Beverly said, "but Dr. Stokes has the authority to make this call, and frankly, the patient's lack of cooperation with the treatment team isn't helping." "He cooperates with me," Petra said. Beverly looked at her over the rim of her reading glasses. "You're not his assigned nurse." "No," Petra said. "I'm not." She went back to her assigned patients. She did her job. At 2 in the afternoon, she passed room 2 on her way to the medication room and heard raised voices, one of them Dr. Stokes, one of them a security officer named Dunn, and she stopped. Through the window, she could see Keller pressed against the headboard. Ranger was standing now, positioned between the bed and the 2 men near the door. The dog wasn't barking. He was still in the way that working dogs go still when they are waiting to understand what is required of them. Keller's hands were shaking. Petra had seen a lot of things in her years, as a medic and then as a nurse. She had seen people in acute crisis, in physical shock, in the particular kind of psychological fracture that happens when the body decides the present moment is indistinguishable from the worst moment that ever happened to it. She knew exactly what she was looking at. She opened the door. "Dr. Stokes," she said. Her voice was level. "Can I speak with you in the hallway for a moment?" Stokes turned. His expression said several things simultaneously, most of them related to the fact that she was not Keller's nurse and had not been invited into this interaction. "This doesn't involve you, Solano." "I think it does," she said. "Because what's happening in this room right now is going to put this patient into a full dissociative episode, and when that happens, you're going to need a lot more than 2 people to manage it safely. I'd like to try to prevent that." There was a silence. Dunn, the security officer, looked at the floor. Stokes said, "Step outside." In the hallway, with the door closed, Stokes kept his voice controlled, but did not bother to keep it warm. "This is not your patient. You have no standing here." "With respect," Petra said, "I have standing as a member of this care team and as a person who has spoken with this patient and has some understanding of his history. He is a combat veteran with documented PTSD. The dog is a certified service animal. The certification is in the VA system. All we need is 24 hours for the VA liaison to pull the records. The VA liaison," Stokes said, "has not been responsive." "Then let me make the call," Petra said. "I'll get the records." "You'll get the records," Stokes repeated. The way he said it communicated very precisely what he thought about that. "Yes," Petra said, "I will." Stokes studied her for a moment. He was not a stupid man. He could read a situation well enough to know that pressing the issue today, in this room, with this patient, carried risks he didn't particularly want attached to his name. "You have until tomorrow morning," he said. "If there is no documentation by 8 a.m., the dog goes." He walked away without waiting for her response. Petra went back into the room. Keller was still against the headboard. The shaking had not stopped. Ranger had returned to the floor by the bed but was watching the door. "They're gone," Petra said. Keller said nothing. He was doing the counting thing. She'd learned this about him. that when the anxiety crested, he counted the ceiling tiles backward from whatever number he started with, because the math gave his brain somewhere to be that wasn't a forward operating base in Kandahar in 2009. She sat in the chair by the window. She did not speak. She did not fill the silence with reassurance he hadn't asked for. She just sat there while Ranger watched her, and Keller counted tiles, and the afternoon light came through the blinds in long yellow bars across the floor. After about 7 minutes, Keller said, "They're going to take him." "Not if I can help it," Petra said. "You shouldn't get involved. I'm already involved." He looked at her. Why? It was a genuine question. She thought about the honest answer, which was complicated, and involved Fayetteville and a specialist named Torres, who had had a dog named after a satellite and had made it home with both legs but not much else, and who Petra had lost track of 3 years ago. She thought about all the nights she'd worked the behavioral health unit and watched veterans cycle through, admitted, stabilized, discharged, readmitted, because nobody in the civilian system knew how to hold the weight of what they were carrying without flinching. "Because it's the right thing to do," she said, which was also true. She called the VA liaison office at 3:15 p.m. and got voicemail. She called again at 3:45 and got a different voicemail. She called the main VA records line at 4:10 and was told the person who handled certification transfers had left for the day. She found the direct number for the certification program that Keller had described, a nonprofit that worked with veterans in the Carolinas, by searching the name he'd given her on the internet from the break room computer. She called it at 4:30. A man named Harris answered on the second ring, and when she explained the situation, there was a pause, and then he said, "Give me your fax number. I'll have it to you in 15 minutes. The fax came through at 4:52 p.m., 38 pages. Ranger's full certification file, training documentation, medical records, and a signed letter from a licensed clinical psychologist attesting to the animal's role in managing Keller's PTSD symptoms and the acute risk of psychological deterioration if the animal were separated from the patient during an inpatient stay. Petra walked to the nurse's station, made 2 copies, and put one in Keller's chart. She emailed another copy to Beverly. She put the original in an envelope with Dr. Stokes' name on it and left it at the desk outside his office. Then she went back to her actual patients and finished her shift. She didn't tell Keller what she'd done. Not that night. She came in the next morning. Not her shift. She'd come in an hour early and stopped outside room 2. Through the window, she could see him asleep. Really asleep, for what looked like the first time since admission. On his side, both hands loose, Ranger stretched out along the floor below him like a shadow. Beverly found her in the hallway at 7:45 a.m. "Dr. Stokes reviewed the documentation," Beverly said. Her voice was carefully neutral in the way that meant something had not gone the way it was supposed to go. "The dog's status has been confirmed. He's staying." "Good," Petra said. Beverly looked at her for a moment longer than necessary. "You should know," she said, "that Dr. Stokes has also requested a meeting with your supervisor regarding your conduct yesterday." Petra had expected this. "Okay," she said. "He's characterizing it as insubordination." "I documented everything I did," Petra said. "Every call, every action, every decision, and the clinical rationale for it. It's in the record." Beverly studied her. "You've done this before," she said. "It wasn't quite an accusation." "Advocated for a patient?" Petra said. "Yes, I have." The meeting with her supervisor happened at 10 o'clock. Her supervisor was a woman named Joan, who had been in nursing for 22 years and had a framed needlepoint behind her desk that read "Patients First" in green thread that had faded to gray. Joan listened to the account of the previous day, Petra's account, then a summary of Stokes' written complaint, without expression. When Petra finished, Joan said, "You entered a patient's room you weren't assigned to." "Yes." "During an active interaction with the attending physician." "Yes." "You then took clinical action, specifically contacting outside entities to obtain medical records, without authorization from the attending." "The action I took was in service of the patient's documented medical needs," Petra said. "The service animal is part of his prescribed treatment plan. Removing it would have constituted a failure to provide appropriate care." Joan looked at her. "That's a strong statement. I can back it up," Petra said. "The documentation is in his chart." There was a silence. Joan turned to look at the needlepoint for a moment, which Petra suspected was something she did when she was thinking something she hadn't yet decided whether to say. Dr. Stokes is arguing that you undermined his authority, Joan said. Dr. Stokes was about to remove a certified PTSD service animal from a combat veteran in acute crisis because the VA record system has a 48-hour transfer lag, Petra said. I found an alternative source for the documentation. The decision he made to allow the animal to remain was his decision, made with complete information, which is exactly how it should work. Joan looked at her for a long time. You know this isn't over, she said. I know, Petra said. It wasn't over. What followed was 3 weeks of what the hospital's HR department called a formal review process and what Petra called the specific exhaustion of having to justify, in writing, every clinical decision she'd made in a 2-hour window on a Thursday afternoon. Dr. Stokes escalated. He pulled in the department's medical director, a man named Portman, who had a photograph of himself shaking hands with the governor on his office wall and who used the phrase chain of command with the reverence usually reserved for scripture. What Portman didn't anticipate, and what Stokes had apparently also failed to consider, was that Keller's recovery, once Ranger was no longer under threat of removal, was the kind of measurable, documented improvement that charts don't lie about. His sleep increased from 40 minutes per cycle to 4 and 5 hours. His blood pressure, which had been requiring daily medication adjustment, stabilized. He began participating in the behavioral health group sessions. His assigned psychiatrist, Dr. Yoon, a small, precise woman who had trained in trauma-informed care and who had been quietly furious about the Ranger situation since day one, put a note in his chart that read, in language that was technically clinical but left very little room for interpretation. Patient's marked improvement in symptom presentation appears directly correlated with the resolution of the service animal access issue. Removal of the animal at any point during this hospitalization would have represented a significant clinical risk. That note went into the formal review. Also submitted was the certification documentation Petra had obtained, which, it emerged during the review, had not been proactively sought by anyone on the care team prior to Petra's intervention. It also emerged that the VA liaison, who had not returned calls for 2 days, had in fact received a fax request for Keller's records from someone in the hospital's administration, a fax that had been sent to the wrong number. Portman, to his credit, read all of it. He took 2 days. He scheduled a follow-up meeting with Joan, Dr. Ewan, and a representative from patient relations. He did not schedule Dr. Stokes. The outcome of the formal review, issued on a Wednesday afternoon, found that Petra Solano had operated outside standard assignment protocols, but had done so in a manner consistent with the ethical obligations of nursing practice as outlined in the ANA Code of Ethics, and had obtained documentation that enabled the attending physician to make a fully informed clinical decision. It found no basis for disciplinary action. It also, and this was the sentence Petra read 3 times, recommended that the Behavioral Health Unit develop a formal protocol for service animal documentation transfer in cases of emergency veteran admission to prevent recurrence of the circumstances that necessitated nurse intervention. Joan called her into the office to deliver the news. She slid the document across the desk without comment and watched Petra read it. Well, Joan said when Petra looked up. Well, Petra said. For what it's worth, Joan said, I've been in nursing for 22 years. I've seen a lot of people do what you did. Go around the attending, make calls they weren't supposed to make, put their own careers on the line for a patient they weren't even assigned to. She paused. Usually it doesn't turn out as clean as this. It wasn't clean, Petra said. It was just documented. Joan almost smiled. Keller was discharged on a Friday 4 weeks after admission. Petra wasn't on shift that day. She found out from a colleague who texted her a picture, not of Keller, who had specifically asked that no staff photographs be taken, but of the doorway of room 2, empty now, the bed stripped. On the pillow, someone had left a piece of paper. In handwriting that was precise and economical and looked like a man who had spent years writing field reports, it read, "Thank you for doing the thing that needed to be done." Ranger's vest was on the chair next to the bed. It took Petra a moment to realize it wasn't left behind by accident. There was a note attached to it in the same handwriting, "For the next one who needs someone to understand." She didn't know what to do with that for a long time. The vest sat on her dresser at home for 6 weeks before she found the Veterans Assistance nonprofit, the same one that had faxed her Ranger's records, and called Harris again and asked if they ever needed volunteers. He said they always needed volunteers. She started on a Saturday in October, which happened to be the same weekend that Mercy Ridge Medical Center sent a memo to all department heads announcing a new protocol for service animal documentation in veteran admissions. The protocol was 2 pages long. In the acknowledgement section, it cited the case that had prompted its creation. It did not mention Petra by name. It didn't need to. She wasn't in it for the name. She was in the parking lot of the nonprofit, lifting a carrier out of the back of her car, thinking about nothing in particular, when a yellow Labrador puppy that was going to grow into a service dog for a combat veteran she hadn't met, yet pressed his nose against the wire door and looked at her with eyes that had no history in them at all. That was enough.